Federal health officials are warning people about risky procedures taking place at med spas, a combination of a medical center and a day spa. And so we have our medical expert, Dr. Payal Kohli, joining us. We see them everywhere. We see the advertisements. So first of all, what kind of stuff are they doing?
Yeah, this is a $15 billion industry, and it really does blur the line between a medical intervention and a beauty treatment. And they're doing everything, Kim, ranging from Botox and fillers to even IV infusions, fat melting infusions, even medications like Ozempic and Wegovy for weight loss.
But they're really doing these things? You talk about fat melting. When you say fat melting, people go, really? Fat
Yeah, I was all in
really
until I heard
melting?
it was...
Are they really using, because they're using the term medical.
Right.
You know, so
Right.
you can say you're a spa, that's
it.
easy. Saying you're medical, you should probably have to meet a certain standard.
Yeah, it legitimizes it, right?
Right.
And it makes people think that it's validated. There is no fat melting medicine except for one called Kyphala, which is injected under the chin here to help with the saggy neck. That has been approved by the FDA. So a lot of these medications, what they're actually injecting are foreign substances, contaminated substances, items obtained from the internet that are supposedly fat melting, but there's no good data to validate this. So these are claims that are unsubstantiated.
And it sounds like there's a pretty well unregulated industry, and that's the concern.
And here's the problem, yeah. So every medical spa is regulated at the state level, not the federal level. So here in Colorado, you're required to have a medical director of your spa, but that person doesn't physically have to be doing the procedures. The people that are doing the procedures are supposed to have some sort of a practitioner license, but that's not always the case in real life. So a lot of times the people that are doing it are not licensed or regulated. And in fact, the FDA has issued 2 warnings in specific about med spas because of all the complications. The first, they're not, many of them are not sanitary. So you're getting infections from them, you're getting complications from them because you're injecting things inside you with them. And then the second, the people that are doing the injecting don't know how to handle the complications and aren't licensed to do the injecting.
Okay, that part really scares you. So, I mean, like you could have like some kind of a beauty license and you'd be injecting someone with something.
That's exactly right. And the person who's getting injected doesn't know. And here's what worries me about injections. When you take a pill, your liver does a lot of work for you. It detoxes a lot of the bad things, the contaminants, and it only releases into your bloodstream from your gastrointestinal tract the stuff it's supposed to. It detoxes. When you inject something, you bypass the liver. You're going directly into the circulation or the subcutaneous fat. And if it is something bogus or something contaminated or something unsanitary, this is a setup for disaster.
So would you get symptoms right away, or in some cases it would take a while?
Not necessarily, yeah. And so, you know, if you get an infection from them, it could take several days or a week for the infection to manifest. It could get into your bloodstream a few weeks later before you manifest. If you end up having too much fluid from them because you have kidney disease or heart failure, you could end up in the hospital with shortness of breath and not even know that that IV infusion that you got is what caused it. These vitamin infusions could cause vitamin toxicities, which could create neurological symptoms that you don't even link back to the spa at all.
You sound more than wary of them. I mean, you're making a very clear point how you feel about them. But whenever someone says lose weight now, lose weight fast, that's like get rich quick or free lunch. Right. I mean, be very circumspect about what they're telling you, what they're selling you.
Be very, very cautious. And if you do plan to get beauty treatments like Botox or fillers, there's some homework you need to do. You need to figure out where they're getting their fillers from. They're not knockoffs, they're not fake, because you're getting this implant injected into your face.
Pretty serious.
You can't take it out.
Yeah.
So make sure they're getting the real deal, make sure the person injecting knows what they're doing, and make sure that someone is there to manage the complications. And they take your medical history. That's a huge red flag. If they don't ask about your medical history,
that's
just have you sign the consent, you've basically given them free rein to inject whatever.
Good grief, your dentist asks you a lengthy thing on your medical history just to look at your teeth. Right. Okay,
well,
all right.
Instead of going to one of those, I'm going to stay here for the rest of the show.
Okay.
Dr. Kohli, thanks as always. You can find all of Dr. Kohli's appearances over at 9news.com/Dr. Kohli.